Sure. Well, IANPHI has come a long way forward to be a big actor on public health and global public health. Our institute, the National Public Health Institute of Mexico, was among the founding members of IANPHI and participated with the guidance of Jeff Copeland in the idea of shaping this incredible organization. So we have been seeing all the process since the beginning. We started with 5, 6 institutes. Now we are 97 institutes. We have faced over this time big challenges for public health, the H1N1, in which our country, Mexico, had a big role, and now the Ebola crisis. And every time we face a crisis like this, we look at the National Public Health Institutes and we see that among them there is the public health intelligence for acting against this crisis. So I think this is an incredible, important organization. What we have been doing over the past 10 years is to strengthen the association, to find ways on how to provide added value to our members. We are a very diverse community because we have large institutes like the CDC, Public Health England, the Robert Koch Institute, China, CDC, and very small institutes in Mozambique, in Guinea, in Sierra Leone. So we have to be very creative to provide added value to all of our members. Well, the future of IANPHI should be to set a big footprint in global health. We are coming out of the Ebola crisis, and again, our institutes play a major role with the vaccine design. Now, what do we need to do? We need to develop a good business model for our organization. By this, I mean that we need to identify very well our stakeholders and our clients in order to bring resources to our institution. Right now, we live very much out of grants that we get funded, very much, for example, with the Center of Disease Control in the United States. But we just signed an MOU with Public Health England, and we hope to develop a similar model. On the other hand, our members pay their dues every year, and that guarantees our annual meeting. But we cannot solely rely on this type of funding. We need to bring additional funding for our institution, and that's one thing that we are going to be working. Other thing that is important is to continue building the name of IANPHI in the global health arena. And after these 10 years, we are planning first to have a strategic planning meeting to define our activities for the next 10 years, to define what type of organization we want to be, how do we want to look in 10 years. And we're also going to set some research groups to provide some papers that are coming from our network and our members. One of those, for example, is lessons learned from the Ebola crisis, in which I think IANPHI has a big say. We can really give the world a lot of lessons.